Hello doctors, this is a session on how to trace a nerve on a patient that has a very atrophied lower ridge using an Anatomage and the DICOM. As you can see the program comes with many tabs here, and this is the first tab section, and I always start out with the volume rendering that can manipulate the jaw in 3D, and just to get me a little bit of guidance, I can see here the shadow of the nerve and the anterior loop right here, danger zone, that I don't think you'll be able to see with a PA or a pan. If we go to the third tab, which is called the arch section, we can see the panoramic here, and good thing about the cone beam is that it's in 1-to-1 ratio. So that means if we look at the spline here, this is the curve that we're seeing from the top looking down on the mandible. If we move one of these dots, the bottom, notice that it changes here. So right now we have a really nice depiction of the nerve on the right side, and on this side right here we can see the cross cut of the mandible. If we move the crosshair here, we'll be able to see the mental nerve coming out. When we start tracing the nerve, we press this button and we can start from the cross-sectional view, as you can see here, and then continue moving the nerve, okay, as you can see here, and then the anterior loop. Okay, if we go to the volume rendering now, you can see how that looks. Okay, so now we are ready to place the implant, and I'm going to choose the right side, and I can enable clipping here, so I'm only concentrating on the right side. Okay, so if I flip it, then I'll be able to get only the right side, the arch. So that's what I'm really interested in, as you can see. Okay. Okay. So to add an implant, I go to this tab here, and let's say that we want to go to number 30, and we'll just try to put this implant, knowing that this is a 10mm implant. We have a library of implants, and change the length of it. As we see, trying to do this free-handedly would probably be very, very difficult, because the access that needs to be done. Most free-handed implants, surgeons would touch on the lingual side and try to feel this and try to go this way. So the implant would be placed that way, okay, versus it being placed like this, or depending on the surgeon level and the skill level. Obviously it's a very difficult access from the tongue side, but if you do have the surgical guide, this becomes really easy. Now Astra has the shortest one is 4x6. I would probably choose that type of implant, 4x6, so the 8mm is, in my opinion, too long. I'd rather have a little bit more freeway here, even though we can measure up the distance here, like about 1.75, 167, and this is at 8mm. So if we go with a 4x6, we'll probably have more clearance. I hope you enjoyed this presentation, and take care.